Welcome. Let's talk about how to use Warts medication step-by-step guide. Attention, do not pick, scratch or cut the warts. This may spread the virus and lead to multiplication. If the warts persist, grows or become painful, consult a healthcare provider, especially for warts in sensitive areas. Warts removal creams work best when used consistently as directed. Step 1. Right medication. Select right medication. Salicylic acid based creams for or bandage used for common and plantar warts. Imiquimod, podophylox commonly used for genital warts. Cantharidin for treatments of filiform warts. Take care about the location of warts. Step 2. Clean the area. Wash the affected area with soap and water to remove dirt and oils. Pat dry the area with clean towel. Soften the warts. Soak the warts in a warm water for 5 to 10 minutes, which helps soften the skin. It helps to more effective treatment, mainly for salicylic acid based creams. Gently file the warts with a pumic stone to remove dead skin. It also helps more effective treatment. Step 4. Protect the surrounding skin. Use petroleum jelly or zinc oxide ointment to protect the healthy skin. Step 5. Apply medication. Apply thin layer directly onto the warts and rub it. Careful application can protect surrounding skin from damage or irritation. Important point, follow the instruction on the warts medication carefully before application. Drying and covering. After applying the cream, allow it to dry completely before covering it with bandage. Some treatment, especially with salicylic acid, may recommend covering the warts with bandage. Repeat the treatment. Typically, warts cream are used to daily or multiple times a week. Wart treatment takes several weeks to show result. Ensure complete removal. Important. If you experience significant irritation, pain or swelling, discontinue use and consult with a healthcare provider. Thank you for watching.